Hey, everybody, and welcome to another deep dive. Today we are going to get into something that you might not think is that exciting, but I think we're going to find it's really fascinating.
I think so too.
We're going to be talking about oral pathology,
Oral pathology.
which is basically all the things that can go wrong in your mouth.
Yeah.
And we've got some really interesting sources today.
Yeah.
We got some lecture slides and a student worksheet that I think are going to turn us into experts on oral health by the time we're done.
Yeah. And it's really something that I think a lot of people don't really think about. And when you think about pathology, you don't necessarily think about your mouth, but
Right.
it's a whole system.
A whole world in there.
Yeah.
So let's jump right in.
Yeah.
One of the first things that our sources talk about is oral lesions.
Well,
I think we've all experienced these in some way or another. I mean,
Yeah.
have you ever bitten your lip accidentally and then had that little bump that forms?
oh, yeah. You mean like a hematoma?
Yeah, hematoma.
Yeah.
Exactly. Or like those painful white spots that just appear sometimes and make it hard to eat.
Like an ulcer?
Ulcers,
Yeah.
yes.
Yeah.
I get those sometimes, and those are terrible. So it turns out there's a whole bunch of these different types of lesions, and our sources go into blisters and pustules, and even compare them to mountains and potholes.
Oh, wow.
Yeah, blisters being the mountain kind of raised up, and ulcers being the pothole,
Uh-huh.
sunken in.
Mm-hmm.
It's kind of a cool way to think about it.
Yeah, it is. It is. And, it really highlights how, when you look at a lesion, it could be a lot of different things, right?
Right.
So, you could have something that looks really similar on the surface, but it could be a blister filled with fluid.
Right. Yeah.
Or a pustule filled with pus. Or, that hematoma that you were talking about, which is filled with blood.
Right. So just because it looks kind of the same doesn't mean it is the same.
It's-
Okay, well, this is making me super aware of all the little bumps and textures in my own mouth right now. But let's move on to something that I think we all can relate to a little bit more, and that is dental caries,
Oh, yeah.
which is tooth decay.
Yeah, the dreaded tooth decay. And, it all comes down to bacteria.
Right.
Streptococcus mutans and Lactobacilli.
Those are the culprits.
Yeah.
I always think of the little tiny drill bits in my mouth.
Yeah, that's a good way to think about it because they're really kind of burrowing into your teeth, and the sources talk about this this triangle visual where you can see it starts at stage S, and the base of the triangle is really broad because it's just affecting the enamel.
Mm-hmm.
And then as it progresses, it gets deeper into the tooth, and that triangle starts to narrow, and that's when it's getting into the dentin,
Mhm.
which is the softer layer beneath the enamel. And then if it progresses even further, it can get to the pulp, which is the center of your tooth where all the nerves and blood vessels are.
That's the root canal territory.
Stage 5E.
Yeah?
Yeah. That's when you really need a root canal because the decay has gone so deep.
Oof. Okay, well, that sounds painful. It sounds like something I want to avoid at all costs.
You and me both.
So, speaking of things that can be painful in our mouths, let's talk about canker sores.
Oh, yeah.
Those are the worst. I always get them when I'm stressed out. Is there any truth to that, or am I just imagining things?
No, there's definitely a connection there. Those are officially called recurrent aphthous ulcers, or RAUs.
Okay.
And while we don't know exactly what causes them, stress is definitely a major trigger along with certain foods and hormonal changes.
So it's not just in my head.
Not all.
Stress really can cause canker sores.
It really can.
Wow. Okay. So, and what about bruxism? I have a friend who grinds his teeth at night, and he's always complaining about jaw pain. Is that connected?
Yeah. Bruxism, which is the teeth grinding, can definitely lead to jaw pain. It can also wear down your teeth and damage the structures that support your teeth. And again, stress is often a big factor.
It's amazing how much stress can affect our mouths.
Isn't it? It's all connected.
Yeah, it really is.
Yeah.
It's kind of scary to think that, just going through life, you could be developing something serious in your mouth and not even know it.
Yeah, that's why those regular dental checkups are so important. We often think of them as just about keeping our teeth clean, but they're
Yeah.
really about so much more than that.
Yeah, they're like those detectives looking for clues.
Exactly.
And, one of the things they're looking for is signs of oral cancer.
Right. And early detection is key with oral cancer.
So it's not just about, avoiding cavities. It's about potentially catching something really serious in its early stages.
Absolutely. And while we're on the topic of things that can seriously impact our oral health, we have to talk about smokeless tobacco.
Oh, yeah. I remember when I was a kid, they used to show those commercials with the graphic images of people with mouth cancer.
Yeah, and those were pretty hard-hitting for a reason.
Yeah, for sure.
The stuff is really dangerous.
Yeah.
And the sources we have here lay it all out there. I mean, chewing tobacco, it just significantly increases your risk of developing those precancerous cells and getting oral cancer.
Wow. And how much more likely are you to get cancer if you use smokeless tobacco?
Well, the sources say that users have like 400 to 500 times higher risk of cancers of the pharynx, larynx, and esophagus compared to non-users.
400 to 500 times. That's insane. Like, that's a huge difference.
It is. It's a really staggering statistic.
Yeah.
And it's not just cancer either.
Right.
Smokeless tobacco use can also lead to other health problems like heart disease, ulcers, and of course, tooth loss.
So basically, like, the risks just really outweigh any potential benefits.
Yeah, without a doubt. It's a stark reminder that the choices we make, even those that seem kind of limited to our mouths, can really have a huge impact on our overall health.
It's like everything's connected.
It really is.
Like, from what we eat to how stressed we are to, like you said, the habits that we develop, it all ties back to our oral health.
Absolutely. And I think that's the most important thing to remember here. You know, oral health is not just about having a nice smile.
Right.
It's about taking care of a really vital part of our bodies that impacts our overall health in some pretty major ways.
Yeah, I think that's a great point. So what can people do to take better care of their oral health? Like, what are some of the key takeaways here?
Well, I think one of the biggest things is just being aware of the risks and understanding how your choices can impact your oral health.
Making those informed choices.
Exactly. And don't underestimate the importance of those regular dental checkups.
Right. Those are crucial.
They really are.
Okay, so we've talked about a lot of different things today, from those tiny lesions and ulcers to the dangers of smokeless tobacco. It's been a real deep dive into oral pathology.
It really has.
But before we go, I want to leave our listeners with something to think about. You know, knowing everything that we've talked about today, what's one small change that you can make to improve your own oral health?
That's a great question.
Yeah, maybe it's flossing more regularly, or finally scheduling that dental checkup you've been putting off, or even cutting back on those sugary drinks.
Those are all excellent suggestions. You know, it doesn't have to be a huge overhaul.
Right.
It's about taking those small steps and gradually building those healthy habits.
So true. Well, that brings us to the end of our deep dive into the fascinating world of oral pathology.
It's been a pleasure exploring this with you.
Likewise. And thank you to all of our listeners for joining us. Remember, stay curious, stay informed, and keep those smiles healthy. You know, it's funny, we were talking about those dental checkups and how important they are, and it just made me think about canker sores.
Oh, yeah.
You know, those things are the worst. And I was wondering, like, is there anything you can really do about them? Like, to prevent them, or at least make them less painful?
Well, the sources mentioned topical agents that can help with pain relief.
Okay.
You know, there are over-the-counter medications that are specifically designed for those kinds of ulcers to help them heal faster and soothe the pain a bit.
Okay, so there's some relief out there.
Yeah, exactly.
Even if you can't, like, totally prevent them.
Right. And there are things you can do to try and prevent them, too, like managing stress and avoiding trigger foods.
Oh, right. Like certain foods can trigger them.
Yeah, exactly.
And good oral hygiene, I guess that helps too, right?
Yeah, absolutely.
Okay, so it's kind of a multi-pronged approach?
Yeah, I think so.
Okay. And what about bruxism?
Oh, yeah.
We were talking about that earlier. The teeth grinding.
Right.
That can really do a number on your teeth.
It can. And it can be really hard on your jaw, too.
Yeah, for sure.
Yeah.
So what can people do about that?
Well, one of the most common solutions is a mouth guard.
Oh, yeah. Like you wear it at night.
Exactly. It just creates a barrier between your teeth, so they're not grinding directly against each other.
Okay, so it protects your teeth.
Yeah, and it can help reduce jaw pain, too.
That makes sense.
Yeah.
And, you know, we were talking about how stress can play a role in bruxism.
Right.
Are there any, like, stress management techniques that people can try?
Oh, definitely. There are things like relaxation exercises, meditation, or even therapy that can help.
Okay.
You know, anything that helps reduce stress and anxiety can help with the bruxism, too.
So it's not just about, like, treating the symptom itself. It's about addressing the underlying cause.
Yeah, exactly.
That's really interesting. I mean, it really shows how much our overall health is connected to what's going on in our mouths.
I think so, too. Oral health is so important. It's really a window into our overall well-being.
Wow, well said. I think that's a great note to end on.
Yeah.
We've covered a lot today. Lesions, ulcers, dental caries, smokeless tobacco. We really went deep on oral pathology.
We did. It's been quite a journey.
It has. And I've learned so much.
Me too.
Thank you so much for joining us on this deep dive into oral pathology.
It's been a pleasure.
And to all of our listeners out there, thanks for being here. Stay curious, stay informed, and keep those smiles healthy.